Hi, I'm Dr. Julie Steinauer. Today I want to talk to you about amblyopia in adults. But before we do, let's tell you about how you can connect with us. If you're local, you can call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. You can do one of two things. Either click on the questionnaire and fill that out for us. At the end, we'll point you towards whether or not you'd like to schedule a consultation. And then you also have the other option of just scheduling a consultation directly with me by clicking the button and taking the next steps. All right, so let's talk about adult amblyopia. You know, for so many people, they have been conditioned to believe that there's just nothing that can be done since they're beyond that special age of 7, that if you don't do anything, you can't fix it, right? Or is that correct? Well, I'm here to say that that's not correct because we do work with adult amblyopia patients all the time. Now, amblyopia is a term that is interchangeably used with something called lazy eye. And the problem is that lazy eye many times is kind of interchanged with other things, so it gets a little confusing. But lazy eye technically means the eye is not able to see clearly and distinctly. It's not necessarily referring to an eye that's turning, although you may have an eye turn or strabismus in addition to amblyopia. So there's some tricky things about what we sometimes call this. So let's call it what it is, amblyopia. Now in adults, amblyopia is still something, again, that can be treated. There is no age where you just can't do anything anymore because you're too old. That doesn't exist. It isn't true that the brain is hardwired and you never can teach it to have better vision after the age of 7. In fact, our oldest patient probably that we treated with amblyopia was close to 80. So there is no age range that we are saying, you're too old. There's also no age range on the opposite end of that that's too young. We can generally not know for certain if someone is amblyopic when they're infants, but around toddler range, we might start being able to assess or know for certain that they may have amblyopia. Now, if a child has an eye turn and it's a constant eye turn as an infant, we may be concerned that amblyopia will develop for them or that eye's not going to be seen well once they are at the age where we can actually test it. But again, this video is talking more along the lines of adult amblyopia. So you just need to know that there's no age range that we can't work with you. Any age range can be taught how to see better with their eyes. Now let's show you what do we actually do for our adult amblyopia patients. Okay, so you know I love Syntonics, and I've got my little box of goodies here because I constantly have this with me when I'm doing a consultation for patients online, and so I'm always grabbing these, especially when I do videos. Now I want to walk you through some of the filters that we use, and you can see I just grabbed kind of a handful. There are a lot of filters. This whole box is filled with them. And so how many do we have? I don't know, 20, I don't know, who knows, a bunch. But the filter specifically being used for patients who have amblyopia and we want to stimulate their brain to be able to see better with the eye is this yellow filter right here. So let's just do a look through the yellow filter. Oh, look, I'm sunshiny yellow. All right, so that's the filter that triggers the brain, triggers the eye, triggers the entire visual system to be able to start seeing and functioning better. And so the eye that's amblyopic, whether it be the right, the left, or if it happens to be bilateral, we can trigger the brain to begin processing vision better and seeing more clear and distinct. Now, we actually use the same filters for amblyopia as we do for some other conditions like optic atrophy and nystagmus. So our nystagmus patients typically don't develop eyesight as clear and sharp as the person who doesn't have a nystagmus or eye moving. And so we treat them like they have amblyopia because they actually do. And so we help them to be able to learn to see and process visual information better. So the same filters that we use for adult amblyopia child amblyopia and optic atrophy and nystagmus, they're all kind of the same filters that we're using for those patients, minus one or two or three that we may be tailor fitting to each individual's needs. Some of the filters are going to be exactly the same. More specifically, the one I just showed you, which was the bright yellow one. Okay, that's the one that we're using for all those patients. Now, if you want to learn more about how we treat adult amblyopia, and maybe you have been one of those individuals who is told it's just too late, you're out of luck, there's nothing that can be done for your case, you're never going to see any better. Might not be the case, and probably actually is not the case. So give us a call if you're local at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com, and you'll have a couple of options. You can either schedule a consultation directly with me, or you can click on the questionnaire button and fill out a questionnaire and get a little feedback about your vision. If you like this video, hit the like button. If you haven't done so, please subscribe so you get all of our videos, because we put out all kinds of cool information. And if you think this would be helpful, maybe you know someone who is older who has amblyopia and they just assumed because they've been told their whole life there's nothing that can be done to fix it, then pass it on. You could give them the gift of sight. Thank you.